Health experts say COVID hospitalizations across the state are going down. A projection from UT Southwestern expects that trend to continue. Joining me now with more on this is Dr. Fahmi Farah. She is a cardiologist and the co-founder of the Global Health Alliance. Dr. Farah, it's great to have you with me. To what do you attribute the drop in hospitalizations across the state, and what other trends are you tracking?
Thank you for having me. It's a pleasure to be here. I am very glad to see that the hospitalization, the new admissions have stabilized. They have dropped to some degree, but for the most part, it's stable. In other words, we're not seeing an increase from what we've seen in the previous months with COVID-19 Delta variant. What could have caused this? I think primarily the awareness that a lot of people have come to realize that vaccinations do work. A lot of people were very resistant in this area, particularly in Tarrant County, to receiving the vaccine. I think more people are now open to actually receiving the vaccine. That has played a big role in terms of bringing this number down. Also, more people are now willing to wear masks. A previous few months, that mask wearing rate had gone down, but with coming of COVID-19, the Delta variant, I think more people are now willing to wear masks voluntarily, and that has played a role in mitigating these numbers as well.
And really quickly, Dr. Farah, we spoke about El Paso reaching herd immunity. Travis County has reached it as well. Does this mean that folks in those communities can just go back to normal? What does this mean for those communities?
Not necessarily. As much as we would like for them to be able to go back to living normally, I don't think we're quite there yet. Herd immunity does take a long time to reach. I'm glad that we're seeing some early signs of that in that part of the state. However, my advice would be to continue to remain careful, wearing masks, avoiding crowds, and definitely start taking vaccinations. The more people that are vaccinated, the better it is. But I don't think we're quite there yet where we can go back to fully normal life just yet, although that's the hope.
All right, that is the hope, but we can't let our guards down just yet. Dr. Farah, thank you so much for your time and your expertise.
Thank you for having me.